Now, healthcare in the United States is the most expensive in the world. You can't really argue against that fact because, well, there are facts. There are numerous studies that show that we pay more than anyone else in the entire world for healthcare, for medication, what have you. Now, if you live here and if you pay insurance, hell, even if you don't pay insurance because you can't afford it, you know how expensive this whole thing is, right? Now, when you try to point out, hey, we are more expensive, but we don't seem to be getting a lot in return, well, you get the standard response of, how dare you? How dare you? We are the best in the world. We are number one in healthcare. We're the best. And we shouldn't go to a different system. No. The system that we have is great. Except for Obamacare, we should get rid of that and go back to what it was before. The golden days of me only having insurance as a person who's wealthy and you not having insurance at all. Well, that's kind of a shitty world, right? But they justify this by saying we're number one. We're exceptional. And if we change the system, we'll stop being exceptional. Well, is there any truth to that? Are we exceptional when it comes to healthcare? Does our system that is private, is that system good? Is that system better than anywhere else? Well, it turns out that no, it's not. Now, despite being the world's most expensive healthcare, the U.S. actually ranks worse among 11 wealthy nations in terms of efficiency, equity, and outcomes. Now, this is according to a study, right? Now, Melissa Hellman of Time Magazine reports that the U.S. healthcare system has been ranked as the worst among industrial nations for the fifth time. The fifth time we're the worst. This isn't the first time we're number 5. Okay? No. I'm sorry, number 11. It's the fifth time that we've been ranked so low. And this is according to the 2014 Commonwealth Fund survey. Now, in this survey, who was the best? We're the worst, but who are the best? Well, the UK ranked best, with Switzerland following a close second. Now, here's what the Commonwealth Fund report does. Basically, what it does is that it compares the United States with 10 other nations: France, Australia, Germany, Canada, Sweden, New Zealand, Norway, the Netherlands, Switzerland, and the UK. Now, according to this report, all of those countries were judged to be superior to the United States based on several various factors. Now, I want you to notice that the countries I just rattled off, well, these are countries that have socialist-style single-payer healthcare systems. Interesting. Now, some of those countries also have private insurance industries that will supplement government insurance to cover things that government insurance can't. I actually think that's a good system, right? Now, a lot of people are saying, especially from the right wing and some corporatist Democrats, are told that they tell us that single-payer healthcare actually leads to worse outcomes, not better, right? You get terrible care. Oh, you have to wait 6 months to get your, if you break your hip, you have to wait 6 months to get into a doctor. Not necessarily. This study actually looked at that and found the opposite. In America, as I said, we're ranked worse, right? And we're ranked worse on quality of care, right? They looked at quality of care, and they also looked at access to doctors and equity throughout the country. Now, results of the study rely on data from the OECD and the World Health Organization and interviews from physicians and patients. So, look, these results showing that we're worse when it comes to quality of care and access to doctors and also equity of care. These are not coming from some leftist George Soros think tank, right? No, this alongside of recorded data is basically asking both doctors and patients, hey, how do you feel about the healthcare system? Is it good? Are you getting good care? Can you afford this care? How long's your wait times? And the answers to that is that a lot of people seem to really like it under a single-payer healthcare system. Whereas in America, you could go everywhere and see complaints about our care. The prices, having to wait, having to fill out insurance, having to argue with insurance companies on what they're going to cover. Okay. Seems like, as I said, they don't have those problems over in other countries. They have different problems, but they don't have these problems. Now, more findings. The report says that the ridiculously high insurance costs are not comparable to the satisfaction of patients or quality of service. High out-of-pocket costs and gaps in coverage undermine efforts in the U.S. to improve care coordination. Now, let me go to that first part, right? So basically what that says is that people report paying so much more in America, but yet when asked, how do you like your care? Are you getting your bang for your buck? They'll tell you, no, I'm paying so much more, but I feel like I'm getting less. I feel like I'm getting ripped off, which essentially is what's happening. That's what's happening right now. It's been happening for a very, very long time. That's kind of what got us into talking about changing the system back before 2009. Now, on that change, right? Well, let me get to that in a few minutes. But first, an issue that was noticed in the survey is the need for equity, right? The report states that disparities in access to services signal the need to expand insurance to cover the uninsured and to ensure that all Americans have an accessible medical home. Well, now wait a minute here. I thought that's what we had. Don't we have universal health care? No, we don't. If you think Obamacare is universal health care, you're wrong. It's not actually what we have. And in fact, the report notes that a lack of universal health care was noted as a key difference between the U.S. and other industrial nations. Now, we have two people running for president right here, right now. And one of them wants to go back, completely dismantle Obamacare, get rid of it, right? Let's go back to the old system. That's Donald Trump, right? And Hillary Clinton is saying that, look, we've got 90% of people covered through Obamacare. That's good enough. Hey, yeah, healthcare complete, right? There you go. Mission complete. We win. 90%. Now, that's a big difference, right? Keeping what we have versus Trump saying, let's get rid of everything that we've done and not do anything to replace it. But don't worry, I won't let people die in the street. What are you going to go and do healthcare? What are you going to do? What are you going to do? There is no plan. And people will die in the street because that's what happened before. But anyway, back onto Obamacare, right? What we have is better than nothing, but it's still not good enough. There are some major problems within the Affordable Care Act. People have ridiculously high deductibles, and of course you have insurance companies like Aetna that are pulling out of the exchanges. That's not because they're not making profit off of this. No, they're making money hand over fist. Now the problem is, and we covered this, is that they were mad and threw a hissy fit and said, well, if you don't let us merge, we're going to pull out of Obamacare. And the DOJ said, well, tough. We're not going to let you merge and create a monopoly. So what did they do? They pulled out. And the effect of that is, of course, is it kind of really hurts the program, the law itself, right? It wrecks the Affordable Care Act. Because the whole point is that we're going to work with for-profit insurance companies to make sure that they play ball so that we can cover a lot of people that need to be covered. Okay. Well, with Aetna pulling out, now you're seeing places like, for example, Arizona that have no Obamacare options. None. Great. Now, some conservatives look at this and they got this crazy conspiracy theory saying, you know what? That was the entire plan the whole time. Yes, that's the entire plan. Let's go and create a law that is bad, that will fail, and put my name on it. Obama sitting in his office, I got this great plan to destroy America. I'm going to give people access to health care. I'm going to put my name on it, but it's going to be such a bad plan that it's going to fail. Shitty plan, right? And Like, you look at that, and you're telling me that Obama took the Heritage Foundation healthcare plan, implemented, so that it gave the healthcare industry, the health insurance industry, a massive gift in forcing people to pay insurance companies that get record profits at the expense of the American people in order to impose government insurance that has been proven to work anywhere it's been tried. That's your master plan. That's the devious plan to destroy America. That makes no sense. No sense at all. But this is something that I'm hearing. And I'm like, you got to be kidding me, right? Nope, Obama's plan all along to get us into socialized medicine. Oh, ridiculous, right? Now, speaking of the healthcare law, Hellman also states, despite the shortcomings in the system, positives do include the breadth of reforms spearheaded by the Affordable Care Act, including new databases for transparent information and financial assistance for low-middle income families in gaining coverage. Those efforts will likely help clinicians deliver more effective and efficient care. The report concludes, another thing is, though, as I mentioned, the entire premise of a for-profit health insurance industry is pretty flawed. Health is not a commodity. It's not something that you should buy and sell or can buy and sell. I'm going to purchase me not getting sick. That doesn't make any sense, right? It's not a commodity. It's not something that can be traded. Health is something that you either have or you don't have, right? And people are going to need healthcare at some point. Everybody's going to need healthcare at some point along their lives. And so, look, I'm not saying that there isn't a profit in some sort of care, but really, I would say save the profit for doing things like unnecessary plastic surgeries, stuff like that. And unnecessary, right? Like, oh, you want bigger boobs. You might want to pay for that out of pocket, or go through an insurance company that specializes in paying for those things. I don't know. That's really not that much of a health issue. But stuff like cancer, for example, treating someone with cancer, that should not be a profit-making venture. Okay? That same cancer patient shouldn't also be fighting, as well as fighting with the cells in their own body with cancer. They shouldn't also have to fight with their insurance company to cover their care, their treatments. And to think that we accept this in America and actually fight to keep it this way, it's kind of crazy. It's kind of insane. I don't know why we do this. The fact is that we're not number one in healthcare, but we seem to be number one in bankruptcies from medical debt. Why? Because, well, other countries don't seem to have this problem. People in other countries, like the UK, like Canada, they go in, they see a doctor, they get back out, no insurance, no fucking around. Simple, right? They need a treatment, they go get it. Here in America, we do shit like Breaking Bad. The whole premise of that show is a guy who couldn't afford cancer treatments, so he turned to dealing meth, and then became a horrible person. Only in America. In Canada, that wouldn't happen. And I know it's a TV show, but still. There are people out there living with debt, with medical debt, who can't afford their treatments. They're probably not out selling meth, but they're trying to find other ways to survive. So this is an American problem. And look, everybody out there, wake up. You're being crushed by the insurance companies. They're crushing you into the ground. Okay, and they're using their paid lackeys in Congress to do so. You've got to realize what the issue is here. It's not Obamacare. Obamacare is a flawed premise to begin with. It's not just that. It's the entire system. It's the entire system of for-profit health insurance. That's the problem. We need to start the transition to a single-payer system. Now, how do we do that? Well, there's some ideas that are being floated. One of them is a public option, and I think that's a great way to start. Put a public option. We almost had it. And then somehow, in order to appease the Republicans, President Obama decided, yeah, you know what? We're not going to get any. We're going to try to appeal to get some Republican votes to pass this health insurance. Plus, the Blue Dog Democrats weren't exactly in favor of this. People like Max Baucus and Lieberman, and Obama thought, well, you know what? I'm gonna take this off the table. Then we can get all those Republican votes. How many Republican votes did they get? None. The only Republican votes Obamacare gets is when they try to repeal it for the 60th time. It did not work. Now, thankfully, we have this conversation now thanks to Bernie Sanders. We're talking about a public option again. And it may not be Medicare for all, but guess what? It's a good start. Hey everybody, if you liked this video, then please like this video and share. And if you want to see more like this, then please hit that subscribe button below.